Hello everyone, welcome to our channel. In this video, I am going to explain about the vertigo. Vertigo means dizziness, spinning sensation where the person feels that the environment around him is moving or spinning. Generally, the inner ear helps in maintaining posture as well as the balance. In the inner ear, there will be semicircular canals, and in the semicircular canals, there will be a liquid called endolymph. And in the otolithic organs like utricle and saccule, there will be calcium carbonate crystals. So, when the person moves his head, the endolymph, which is present in the semicircular canals, also moves, and in turn, this causes a sensory sensation which from the ear, this sensory sensation will enters the brain, and from the brain, it enters the spinal cord where the balance is maintained. But in certain conditions, in where if there is excessive endolymph in semicircular canals, or if the otolithic organs, which are in the otolithic organs, if the calcium carbonate crystals will be present, but in certain conditions, these calcium carbonate crystals may be displaced into semicircular canals. Because of these conditions, there will be mismatch of the sensory input, and with this causes the vertigo. Vertigo can also be seen in normal conditions, like whenever we sit in the giant wheel or we spin in circles, and suddenly if we stop, and this endolymph may move here and there and may causes vertigo. So vertigo occurs mainly because of some ear infection, and other common reason is BPPV. BPPV means benign paroxysmal positional vertigo. BPPV mainly occurs because of viral fever, viral infection, mainly after post-COVID recovery. These days, after post-COVID, vertigo is more common, and after common cold, cough, because of head trauma, aging, and because of all these conditions, vertigo can occur. As already mentioned, that calcium carbonate crystals will be seen in otolithic organs like utricle and saccule. But because of certain conditions, these calcium carbonate crystals may be displaced into the semicircular canals, results in vertigo. And the symptoms in BPPV are very peculiar, that is positional. If we are still, there is no problem. But if we move, if it is triggered by movement, means if we move our head, if we turn our head suddenly, or suddenly lying down or walking, because of head movement, the vertigo will be seen, and the vertigo symptoms in BPPV are very less than 1 minute. It lasts less than 1 minute, and it may last up to several weeks also. In certain conditions, there will be excessive endolymph in semicircular canals like Meniere's disease, where the vertigo lasts for several hours, and along with vertigo there will be tinnitus, that is ringing sound, and it may be associated with the hearing loss. Main important point is in Meniere's disease the vertigo is spontaneous. It does not associated with any movement. And also vertigo can also occurs because of nerve problems. Why? Because vestibular nerve and oculomotor nerve, these nerves carries the sensation of hearing. So whenever there is cyst or tumor in the nerves, or it may be because of vitamin B12 deficiency, vitamin D deficiency, and when there are low sodium levels, low sugar levels, low BP levels, and if there is any brain stroke or tumor, there are chances of vertigo. Usually the vertigo is checked by ENT doctor as well as the neurophysician. And doctors can diagnose this vertigo by simple tests like Hall-Pike maneuver, which is a positional maneuver test, and certain blood tests are needed like vitamin D, vitamin B12, blood sugar level test, and in certain conditions, CT scan and MRI scan is usually needed to detect the brain as well as the nerve problems. Coming to the care, whenever there is vertigo, we should reduce our stress by doing exercise, walking, meditation, etc. And proper sleep is required. While sleeping, we should elevate our head by keeping the pillows under the head, and while waking up also, we should not wake up suddenly. First, we should sit and slowly stand, and proper hydration is required by drinking water, ginger tea, and we can also drink warm water mixed with apple cider vinegar and honey. We can reduce coffee intake, and also we should reduce the screen time. In vertigo, especially BPPV associated vertigo, we can do Epley maneuver or canalith repositioning procedure, where the displaced calcium carbonate crystals are come back to its original position so that the vertigo is reduced. This Epley maneuver contains 4 steps. In the first step, the person's head should turn towards the 45 degrees towards the affected side. It means if the vertigo is because of left ear infection, the person's head should turn towards the left side and the person should move from sitting position to reclining position, and we should maintain this position for at least 30 seconds. And after this, the second step is needed, where the person's head is turned towards the opposite side and it should be kept for at least 30 seconds. In the third step, the person should completely roll back on your side and turn head towards the unaffected side, and this position should be maintained for 30 seconds. In the fourth step, the person should carefully return to the original position, and in this position the head should be tilted down and this position should be maintained for at least 15 minutes. In the first 3 steps, it should be minimum 30 seconds, whereas the fourth step should be maintained for at least 15 minutes. In this process, we can reposition the crystals which are displaced into the semicircular canals. We can replace into the normal exact position. Coming to the care to be taken in Epley maneuver, we should place the pillows below the shoulder blade and not in the neck, and first 3 steps should be for 30 seconds and the fourth step should be 15 minutes. And certain doctors can give certain medicines like Vertin, which include 8 milligrams or 16 milligrams depending upon the severity. This is all about the vertigo. Hope you like the video. If you like the video, please share and subscribe our channel. Thank you.